Hi, welcome to the Paso Norte Health Foundation's Wellness Wednesday Q&A. My name is Dave Acosta. We'll be bringing these lives to you each Wednesday at noon to discuss a different health topic and how it relates to COVID-19, your loved ones, and you. We encourage you to log on to El Paso COVID-19 Information Hub, which is located online at www.epcovid19.org. It's a bilingual website full of local resources that can help you and your family navigate the COVID-19 crisis. It includes information for parents, veterans, employees, and employers. There's valuable resources to help loved ones address mental health issues, food insecurity, homeschooling, physical activity, and much more. Many of those resources are free and available from home, either online or by phone. And these are also some of the topics we'll be discussing on future Wellness Wednesdays here on Facebook Live. Today, Enrique Mata, who is the Senior Program Officer for the Paso del Norte Health Foundation, he oversees the mental health and emotional well-being initiative for the foundation, and he'll be answering your questions today about mental health and really focusing on how kindness can have a positive effect on our mental health as we try to work through this crisis, work from home, maintain our families, and maintain our lives. How are you doing today, Enrique?
Doing very good, Dave. How about you?
Good, good. Good to see you here on Facebook. So as we all know, many of us are working from home. We're helping our kids try to do their homeschooling, etc. What are some things that people can do to cope with these changes in their daily lives right now?
Well, we certainly know that these are times of, I guess, challenge and adversity. And in many cases, that's where we find the best in ourselves. And that's what we really have to be focused on. Meeting these times with kindness and caring is vital. Uh, some of the things that you can do to cope are some examples would be things like setting up a weekly plan uh, and sticking to it. Whether it's moderation in eating, times for you to exercise, times for you to look and organize your records, those kinds of things. But the most important thing in that respect would be to stay connected. When we talk about physical and social distancing, we mean not to be close to people that are out of and stuff. But we do want to make sure that people understand that being connected is a vital part of the emotional health of individuals.
Okay. And so just to let some of our viewers out there know, if you want to submit some questions in the comments, we'll be moderating those questions and asking Enrique some of your questions as we go along. One of the things that we talked about in the intro was how just kind of being kind to each other can go a long way to help improve and maintain your mental health. What are some ways that individuals and families can practice random acts of kindness with each other?
Well, thanks, Dave. That's an excellent question. And when we talk about random acts of kindness, we're not talking about really difficult things to do. Sometimes it's as simple as being a role model in your home or your own home. We're talking about when you need to, when escalating tensions start to come up, that you use your inside voice and bring things down to a level. Look at ways to start a chain reaction of kindness. Just think about positive things. Try to find solutions. Break problems down to smaller forms. Those are some examples of things that you could do in your own home. Things like talking with each other about difficult situations. The other thing that you can do is certainly helping community, kind of a pay it forward kind of thing. Make phone calls to your friends, talk with friends and neighbors, find out if there's someone out there who might need additional help, maybe a person who's ill or a family who's dealing with an illness or an older adult who is kind of isolating, but they need supply. Those are areas where you can maybe help them out by taking stuff to their door and letting them know that we can help you get the things you need. Those are some examples.
Those are good examples. I know that those random acts of kindness, they can go a long way, not only for the people receiving them, but also for the person that is doing the actual act of kindness. Correct?
Definitely. And if you want to volunteer, there are certainly places to volunteer. And the as you said in the beginning, the epcovid19.org website has places for, if you want to help out, you can go to that section and you'll see some information. I believe United Way is coordinating volunteer opportunities.
Great. Those are all great tools. And of course, as you mentioned, you can find a lot of those tools and resources on the El Paso COVID-19 Information Hub, which is located at www.epcovid19.org. There's lots of free and valuable resources out there for you. One of the other questions that we had was, what are some other ways that people can cope with either anxiety, stress, depression during this time?
Well, let's think about again, one of the most important things with regard to that and coping is breaking things down. There are so many things that are out of our control. You know, we've got a national movement to do social distancing, but that doesn't mean we can't do some things for ourselves, like maybe try exercise challenges or take a walk with yourself or by yourself or with a friend or relative, or if you have a pet. Some other things that are really good that people don't recall sometimes because we've been so tied to social media is that you can put a recipe together with the family, test some things out, use some foods that you've never tried before maybe, and come up with new traditions. You can also settle down to kind of distraction-free music, or sometimes there's just too much going on, and you need to just turn the TV off, or uh, turn off the social media and just take some time to relax and reflect. Talk about what your family values. Talk with your kids, not at your kids. If you're dealing with stressful situations, be that role model again.
Great. So we got one of our first questions from Facebook right now. Erica wants to know, how can we help children understand what's happening? Should we address it or wait till they ask?
That's a great question. And every child is a little different, but one of the things that you want to do is try to be honest and talk about things in an age appropriate way. Some children need to understand that yes, this is a certain time when this is happening, that it's beyond our control, but we do have to help them understand that there are things they can control, like being together with their family, reinforce that you're there for them, they're never alone. And for older youth, don't treat them like adults. Answer their questions candidly. Talk with them about the situation, and ask them what else they really need to know, so that you can help them cope. Um, those are some things that you can do for children in your family. Certainly, if a situation's coming where an individual is not functioning or not able to cope well, don't hesitate to seek out help.
That's some very valuable advice. Um, we have another question from Facebook from Miguel. He was asking, what can we do after quarantine is done to kind of adjust back to a normal life and not carry over any other negative mental effects? And I think going back to the kindness, I think that's something that we can carry through in our daily lives even after this is over.
Certainly, and we're in unprecedented times now. This is something that hasn't happened in 120 years, and this is a great opportunity for us to reflect on what our lives have been before this situation, and what can we do to maybe be the better people that we wanted to be. Um, you know, Life changes with shifting from one job to another sometimes happens. Those are opportunities when you can look at, where am I today? Do I want to get some more education? Do I want to uh, look at a different way to use the skills that I've got to maybe get into a different career path? These are opportunities that we can look at and really reflect on right now, so that when the time comes that uh, we come out of this, which we will be, you know, better able to work through and get back into society and live a healthful life.
Right. Okay. Um, so let's say now, so a lot of us have been working at home or helping our children work on their schoolwork at home now for close to a month. Um, what are some signs that people should look for that a family member or even themselves is not coping well with these changes right now?
Certainly, the key indicators are that inability to function or having trouble with relationships. If you're seeing some consistencies around that, maybe use of substance use, maybe situations where individuals just are not able to, extreme sadness or not just not functioning, or maybe having difficulty with relationships. In those cases, don't hesitate to seek help. We are in unprecedented times now with the ability to help through telehealth, and in many cases, you can get some help into your home through a virtual support system, whether it's a physician or a counselor. These types of options are available.
Okay. We have another parent on Facebook asking a question about what if a child has heard from other peers about COVID-19 and now they're kind of having anxiety because they fear one of their family members could get sick or something like that. I think that's a good opportunity maybe to talk a little bit about what's available, what resources are available in the community for children and some of the stuff that's on the information hub.
Definitely. One of the things to reinforce again is that there are certain things that are beyond our control, but certainly the things that are within our control are the fact that we can be loving and caring individuals and maintain a nurturing environment, decrease the tension around the topic, and try to focus on things that can be controlled. Things like, what are we going to eat this afternoon, or maybe we can do some exercise. Just being honest, but then also trying to find positive ways to cope with the situations. When we talk about needing additional help, yes, the apcovid19.org website certainly has an area that says, what if I feel anxious? In there, you'll find resources such as 24-hour crisis lines and other providers out there who are willing to provide telehealth services and talk with family members. There's also one of the crisis lines I'll mention right now is the El Paso crisis line, 915-779-1800. Or you can even go to a crisis text line, which is texting the word home to 741-741. These two items are available 24 hours a day, 7 days a week. You can also, if you need other assistance, you're not sure about where you're going, epcovid.org, 19.org has that information, but you can also call 211 if you're looking at situations where you're looking for rental assistance, you're looking for these kind of things. You can help get some questions answered through these opportunities. You're not alone.
Great. So I think we're coming to the end of our time here on our first Wellness Wednesday. We thank everyone for joining us. Was there any last words you wanted to add for us, Enrique?
Just for me personally, I want to convey to all of the first responders and healthcare workers and providers. I'm a nurse myself, but I want to say thank you to all of you for being out there on the front lines and taking care of the folks who are ill. And for everyone else, please stay home, practice social distancing, wash your hands, and we'll get through this together. Thank you very much for your time, and back to you, Dave.
Certainly, thank you, especially to first responders who are out there on the front lines trying to help us get through this current crisis right now. Thank you, Enrique. We thank everyone who joined the Facebook Live. Thank you for submitting questions or for just watching. This Facebook Live is going to be available to watch later on the Paso Norte Health Foundation's Facebook page, as well as YouTube. Please tune in next week at noon when we'll discuss a different topic for the community as it relates to COVID-19. Remember to log on to the El Paso COVID-19 Information Hub at www.epcovid19.org. There's a wealth of information and resources available there for individuals, families, employees, business owners, students, and other members of the community, as well as valuable resources to help you or loved ones address mental health issues, food insecurity, homeschooling, physical activity, and a lot more. And we're updating that website daily with more resources and more information for the community. Many of those resources are free and they're available from home, either online or by phone. So again, just go to www.epcovid19.org and see what help we can provide you. Thank you very much and enjoy the rest of your